Come on in, y'all. Come on in. Let's gather as a family. Let's have a conversation. Let me just say trigger warning, trigger warning, trigger warning. Okay. Because we're going to talk about this viral video of a Black woman once again being lost, being not heard by the system. All the time. We're seeing it in our faces that our pain does not matter. We don't matter. Okay, and being that I live in Texas now, okay, we're gonna get into some things. We're gonna talk about it. But if you're not familiar with this viral story going around, this young woman was supposed to be having a baby, okay, in Texas. She was supposed to be induced, and she was calling this hospital. They knew she was going to arrive because she was supposed to call to make sure they had a bed for her. She has been calling, asking if they have a bed. They never followed up with her to let her know they got a bed ready for her. So at some point, the baby is coming very fast. Okay, very quick, very fast. So her and her mother drive to the emergency room. Okay. And first they are told when they pull up to the emergency room, oh, you can't park right here. You can't be right here. I'm sure hearing her daughter screaming, yelling, in pain. Because hey, once you hit that, what was it, 5th centimeter? Don't talk to me. Okay. Don't talk to me unless you got the drugs in your hand. Now I was there. Okay. Was it my second baby or my first? We'll get into my story in a little bit. But they pull up in the emergency room. People are like, you can't be right here. You got to go to the front. It's like, wait, what? So they tell her she got to go to the front. Okay. But let's get into it. But this story is going viral. If you have not heard, we're going to get into it as a family. Make sure you hit that like, you subscribe, you do all the things to support my channel. Hype it up if you got hypes left over. Comment, share, subscribe. Let's go. Okay, let's go. Once again, trigger warning though. Trigger warning.
Right now. Is your What? How many times have you been pregnant? 3. This is your 3rd pregnancy? Yes. You have 2 babies at home? It's in my ass. You have 2 babies at home? Who's your doctor?
Lang is her doctor.
This is ridiculous. She's not even looking at her. The nurse is not even giving her any care.
Like this or just the Black ones?
Last name is Jones. She's G3P2.
No care, compassion.
Her due date is the 10th.
It was the 10th.
She had 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors.
Thank you.
Everybody say how they treat people here.
Where was the compassion, y'all? Why is it that Black women, when it comes to our pain, we have to suffer in silence? Oh, she's just making it up. It can't be that bad. You can go back to work. We've seen these stories over and over again where a Black woman is in labor or post-delivery complaining of pain. Oh, she just med seeking. Okay. She just wants some pills. But I think this is a disturbing thing that we're seeing over and over again. And I think for some of you guys watching this, it could be re-traumatizing. So I'm taking some time with care because I think there's a lot of people who have suffered birth trauma and we don't talk about that. Labor is one of the most vulnerable parts of a woman's life. Where's the safety? compassion, and attunement. All those things are critical. All those things are critical. And I wonder, what was this mom, both of them, her mother and her daughter, the one going into labor, were feeling, thinking. And some people say the closest you get to God is going into delivery and having a baby. Okay. And how this experience can also trigger PTSD. Okay. Now the doctor is not doctor, the nurse is like, I don't care. I don't care. Okay. She's saying, I don't care. Okay. She's saying, I don't care. This is racism, medical racism. No acknowledgement. No, the doctor's on their way. Let's get you to a room right away.
Yeah.
Do you need anything from me?
Someone is coming to take you to labor and delivery. That's not what I asked. I cannot know. Thank you.
Just no consideration, y'all. No consideration. Let's hear what the mama was saying.
Hello, TikTok family. This is a follow-up on the video that I posted earlier. So I was at work. I had no idea of the activity that was going on. My daughter's texting me, calling me. I didn't know what was going on. So finally I get home, they tell me about the video, and a lot of you was asking about a follow-up and to explain the situation. So this is the situation. My daughter went into active labor at home. We took her to the hospital. She called ahead of time. So we know they are expecting us. However, we get there to the emergency room. We watching nurses, putting gloves on, running to the door. They get outside of the door, and I drive a black SUV, and they look at my vehicle, and one of the nurses come up to the window and she goes, I'm sorry, this is for ambulance only. I said, well, my daughter is in active labor. And she was like, okay. She said, but you're going to have to go to the front. I'm like, I have to drive to the front. And they said, yeah, you have to drive to the front. Okay, another redhead. Mm-hmm. And so I'm like, so she's you hear, and it was like, yeah, she started bagging up, hit the button, went back inside the building. So I go around to the front. I get out of the car. Again, this girl is in more pain now than she was when we first left the house. And she started saying, I feel pressure. I feel pressure. I said, take deep breaths. I ran in. I said, hey, my daughter's in the car. I went to emergency. They told me I had to come to the front. So the lady was like, what's your daughter's name? Told her Kiara Jones. She gets out some paperwork, start typing in the name. I was like, ma'am, do you have a wheelchair or anything? She's in the car. I need to get her in. Oh, if you check on the other side of those doors where the vending machine's at, that should be.
Now, I wonder if they treat everybody like this. Okay. Everybody versus us. I gotta sneeze. If they treat everybody like this, or just us? And I think we all know the answer to that question. Okay. Nurses and medical staff are exuding power right now. They're showing us their power and how they're going to use their power against us. And it's sad because it's not all nurses, but these nurses give people a bad name for the nursing industry. Okay. This is a power play showing us once again, we have power over you. As we have seen throughout this political climate, we have power over you. We can take things away from you. Okay. And we've seen nurses throughout the year, even the one, I think it was in Santa Barbara, where the nurses took pictures of the discharge fluids on the pads, medical beds as people were leaving the appointments. Okay. Mocking. minimalizing and providing rough treatment. This is going to create long-term pain. There's no trauma-informed care here. And I wonder how much of it at the forefront is trauma-informed care in medical settings. Okay. And I know in the comments, people were like, she's just doing her job. Just doing your job is not enough. Okay. People don't need clinical competency in these moments, they need empathy. Laboring patients rely heavily on staff for emotional and physical support. Help me believe I'm going to get through this. Help me see that this is just a moment. It's going to be a memory. Okay. But because of so many systematic issues, some of y'all might say it's burnout, understaffing, other systematic barriers that create these behaviors, but they do not excuse them. Okay. They do not excuse them. And I think there's a rise of medical trauma and incompetence and lack of empathy and compassion on the rise. And our phones make people feel like it's okay. It's okay. Okay. I see other nurses on social media going on live while they're doing med passing. When has this become more important than your medical license? The views, the likes. What is going on? Okay, what is going on? Where are we?
Be a wheelchair out there. There's no wheelchair out there. So she gets up, she walks in the back, and she come to the door with a wheelchair. She said, "Here you go, ma'am." I said, "Excuse me, you're not going to come with me?" And she was like, "No." Oh, okay.
No.
So a police officer was in the lobby. He gets up, he grabbed a wheelchair, he goes out the door with me. He said, "Come on, I got you." Went out there. She is on hands and knees in the back of the vehicle. And I'm like, "Oh shit, what is going on?" And then she goes, "It's in my ass." And I was like, "What?" And the guy was like, and she was like, he said, "Okay." She was like, "Give me a minute." She could not move. So when that contraction eased, we put her in a wheelchair. He said, "You can go park your car," because they again had people out there. So I went park my car. It wasn't even 30 seconds. I run back in the building. She's just there with a stack of papers in her hand, screaming that this baby is coming. This baby is coming. I look at the registers behind the window, and they looking at me, and they was like, "Well, we can't do anything until she signed the papers." Are you fucking kidding me?
They didn't want to do nothing.
So I grabbed the papers, and of course, it's all ER bullshit that they have. And I was like, "You want her to sign this, and she's in active labor." And they was like, "Okay." I was like, "Ma'am, she was supposed to be induced earlier today at 8:00, and they called and told her that they will call her because they didn't have beds, and they will let her know." And no one ever called back. They called back every hour on an hour, and it was like, "No, we'll call you back." And then finally, her water break, she called them. They tell her to come in. So why is she signing these papers? We need her in labor and delivery. And it was like, "Ma'am, I'm sorry." So the charge nurse comes out, and she saw the paper signed. What fucking, are you serious right now? And
I remember my own, I think it was like my first, I think it was it my first or my second pregnancy when I showed up to the labor and delivery. Similar but not the same situation. But yeah, they really are about, some of them nurses are about them documents. I'm like, don't talk to me until you hit me with the drugs. Okay. She asking me, when was your last doctor's appointment? Are you allergic to anything? I get that those things are important. I really do. But right now, the pain, lady, the pain. Can you call the doctor? Okay. And they put me in this little room. I was in a bed. But in that experience and thinking about it now, I'm like, was that how it's supposed to be treated. Like, should I have gone to I was put in a room, but should that nurse have had more care? And I think the nurse was actually Black. But I'm like, why does this stuff matter right now? I'm in so much pain. And I think at that point I might have only been 4 centimeters. But I literally said, do not talk to me until that lady come down here and put that shot in my back. Nobody talked to me. Okay. I think that was my first pregnancy too. I went through all the labor and the Lamaze classes. My personal opinion, y'all have your own situations. That shit don't matter. That shit don't matter. Like, once the pain hit, I forgot the breathing classes. I forgot all that stuff. Because at the forefront of my mind was stopping the pain. I forgot all about it. But my sister's having a baby, and I hear other clients talk about having babies and how they're going to all the classes to prepare, like the hospital tour, labor and delivery tour, the Lamaze classes, breath work, yoga breath work. And in my own opinion, this is only my opinion, I just truly feel like when I was in labor and delivery, I forgot all about that stuff. All that mattered to me in that moment was stopping the pain. Don't touch me, don't talk to me. My husband rubbing my head, I don't care. But that's just my opinion. I don't tell that to people, to clients, 'cause I'm like, it's your own experience. My experience does not matter. What is at the forefront is yours. And if you feel like you want to attend those classes and all those things, it's your first child. Do that, do you. But I personally don't feel like, in my opinion, they really matter. Because half of the time, like, you forget all that stuff because you just want the pain to stop. But everyone's experience is very different. That's just my birth experience from number one.
She closes the door. And then the lady behind the window at this point, my daughter, scribbled her name on all the papers. We gave it to her. She says, thank you.
Passive aggressive.
Walked it around to the charge nurse. She opened up the door. My daughter is literally like having a contraction. And she's just standing there in the door. So we push her into the door. I said, can we get her into labor and delivery? She said, no, we have to fill out all this paperwork. I have to do the paperwork
here
and get her a band before we can send her upstairs. So that was the video that you guys saw that I initially posted. So the next video that has no picture on it was when I was pushing her in and we was at the window because they asked me to move her from the window so they can take care of other guests or, patients that was coming in and out. Do not go to this hospital. This hospital is ghetto as hell. They do not care about Black women or their babies.
Now let's talk about cancel culture. Because the internet, investigators, police, they know how to find you. Okay. And I think we're in a day and age of accountability. And what does it look like? Some people might feel like accountability is training, more supervision, corrective action, calling the license board, policy improvements. Okay. But I think now we're in a day and age of accountability means your ass needs to be fired. And I think that's just what the people did. Okay, that's just what the people did. She got fired. Okay, she got fired. They found her. A whole bunch of people filed complaints, as they should have, with the licensing board, with the hospital, and people are telling this woman and her daughter to sue. And they should, for medical neglect, the trauma that I'm sure she's going to be living with from this birthing experience. And they said the baby was actually born with green fluid, I believe. I forgot where I saw that at, but he was born with his eyes open, and I think green fluid in the placenta, which shows that the baby was actually in distress. Okay, medical neglect. And it's no way you can kind of deny the claims of medical neglect when it's all over the internet. Okay. And I think for a lot of people, the video very much validates their experience of being dismissed by medical professionals and expose a cultural problem in some of these medical environments. Now, as much as the phones are a bad thing at times, nurses, passing meds, day in the life of a nurse, showing clients' faces. At the same time, in this situation, this phone exposed not only the nurse, but the hospital. And it triggered conversations about racism, bias, inequality in medical and maternal care, especially in Black women. We face disproportionately higher rates of harm. So many stories over the last couple of years of women being in postpartum recovery, blood clots, infections, saying that they weren't feeling well, and they were ignored. And because of those, things being ignored, those babies went home without a mother. They went home without a mother. So that's another thing that we face when going into a pregnancy. Will I come out of it with a baby? Are these people going to treat me right? Should I just do a birth at home? Should I go to a birthing center? But then there's also the privilege of those things. Not everyone has the resources, the funds, live in a place where you can go to a birthing center, where you can have an at-home birth, where you can have a doula. Those are also privileged things. And I think we need more systematic change, more access and affordability. But with the current economy, the current political state, those things are going to be more costly and push out people who really need it, honestly, because medical care is it's going up and it's only going to increase. But I think from a therapist perspective, we need more trauma-informed care. And I want to ask you guys, are there ways to rebuild trust? Okay. Are there ways to rebuild trust in this situation? Let's look at this.
You can respond to a Black woman who's going to have a baby in 12 minutes. Hey, you, grab me a stretcher and call labor and delivery. I'm getting us some help. I'm going to stay right here with you. All I need right now is your name. We'll figure out the rest later. In fact, are you okay if my friend gets some basic information from your mom? That way we can focus on getting through this. You're doing amazing. I know you're scared. It's okay to be scared because I'm not scared. And you can borrow some of my not scaredness because we're going to get through this together. Move around in whatever way feels most comfortable to you. And let me know if anything feels different. I'm staying right here with you. These are ways
This is all you need.
that you can respond to a Black woman who's going to have a baby in 12 minutes. Hey, you.
Does this need to be a training video? The common sense? Does this need to be a training video? The common sense. Okay. This is what respectful, compassionate care looks like. Listening to the patient, believing their pain, explaining procedures, providing consistent choices and consent, maintaining dignity and confidentiality. Where was the dignity here? Where was the dignity here? And for those of you guys who have been through your own medical trauma, who were re-traumatized, were triggered by this video, some of you guys, it may have created or increased the fear of being pregnant. We don't talk about that either, how some people are so fearful of childbirth that they never want to experience it. Okay. But I want to validate what happens to people when they go through birth and the birth trauma. Okay. I want to validate the people who were told it's just a part of labor. I want to encourage going to support groups, discussing it, going to therapy, advocating for yourself with future medical encounters. Your voice matters. Your voice matters. Okay. We need more compassion and accountability. In this situation, accountability looks like you're fired. Okay, you're fired because this is also not the first incident she's had. She's had other incidents. This nurse, Lacrista, I think her name is. We need safer environments, more humane maternal care. And I think we should continue to have this dialogue because unfortunately, it's not going to be the last time, y'all. It's not going to be the last time. And I hope they do sue. I hope there's some care for the mother, for the baby, some therapy, of course, support. And what I want to know for you guys, what does support for this mother post this situation look like? What does accountability look like outside of firing? Are there other ways? And how are they training new nurses as they're coming in when the old school nurses are the ones training the new school nurses? Okay, think about that too. Them jaded nurses and burnt out ones, those ones who don't care, who have been at bedside the last 40, 50 years, training the newcomers. What they train them like. Okay, how they train them to treat people. People. We are people. We are not animals. We are Black women going into the medical system with fear. How is this doctor going to see me? How are they going to treat my pain? And will I leave the hospital with my baby? Okay, with my baby. Now, let me know how'd you guys find about this story? Have you heard it before? Let me know your thoughts. But once again, I'm Denise Brady, a licensed marriage and family therapist. Hit that like, share the video, join the community, and I will see you guys in the next one. Okay, in the next one. All right, bye.